Next up is Sujitha Ratnasingham, and Sujitha is the Director of Data Partnerships and Development at ICES. And as we've been talking about data and opportunities for data, Sujitha is going to come up and tell us about future directions in data and discovery at the Institute. Sujitha's focus is to build data partnerships that support the acquisition of both health and non-health data to create opportunities for innovative scientific research that will contribute to improvements in healthcare planning and policy evaluation. Sujitha originally joined ICES in 2008 as an epidemiologist. She left briefly to work at Public Health Ontario, but quickly saw the light and returned to ICES just about a year and a half ago, I guess, is it? I got that right? And we were delighted to have her come back in this new role as director. So come on up, Sujitha.
Before I get started talking a bit about the future and the directions we're heading with data and data partnerships, I just wanted to play a video that'll outline a little bit of background about the way that we deal with data and data specifically.
Since 1992, the Institute for Clinical Evaluative Sciences has been working behind the scenes to improve Ontario's healthcare system and the health of the people of Ontario. How do we do all this? Let's break it down a bit. The Ontario government collects routine information about healthcare system use so it can plan, administer, and pay for health services. All this information is called administrative data. A new piece of administrative data is created every time someone has an interaction with the healthcare system. Whether it's a visit to the doctor, a prescription being filled, or a hospital admission, every piece of information is important. Usually, this data is stored in separate databases, but the real power of administrative data comes when we link them together to create a big picture of healthcare patterns and trends over time and across Ontario. Linking the data lets us look deeper, way beyond the individual picture. It allows us to identify problems and evaluate potential solutions that will improve healthcare for the whole population. We go to great lengths to protect this important data and the public's privacy. In fact, the first thing we do is to remove names from the data before it is used for research. Through our innovative use of administrative data, the Institute for Clinical Evaluative Sciences generates powerful evidence that is used in the planning and evaluation of Ontario's health system. Evidence that supports better policy, a stronger healthcare system, and healthier people.
And these are all factors that are critical for us to achieve our mission and our vision over the next 3 years. I'll be focusing on 3 specifically that are relevant to our discussion today. The first is data leadership. So data is at the core of our work and research, and we continue to strive to obtain the highest quality, most diverse, comprehensive data. And this is to continue our role as recognized leaders in data stewardship. And some of the activities that we're doing are developing a data acquisition strategy, enhancing the value of ICES data, improving data and research infrastructure. The second success factor is research impact. So we're increasing our capacity to conduct novel research by investing in new and innovative areas. And this includes a focus on social determinants of health and non-health data. We're also ensuring our research activities align with our core mission, research priorities, and stakeholder needs. And part of ensuring that we're aligning with our partners and our stakeholders, such as yourself, is through consultation. And our this mic does go in and out. And our strategic partnerships is to support, to focus our support to grow partnerships with Indigenous leadership organizations and communities. And we're very grateful today to have with us representatives from Chiefs of Ontario and Tunga Suvingat Inuit. So I'll talk a bit about now some of the things that we've been able to accomplish in collaboration with our partners. So the first is a data partnership strategy. So we've developed the strategy to really ground the way that we approach partnerships, data partnerships in particular, and the relationships to acquire data. And this will enable us to align our priorities and enhance knowledge translation and impact across the ICES community and beyond. Its core principles are enhanced engagement, which is really about building new and deepening existing partnerships, being more strategic about data partnerships, so identifying and prioritizing key data holdings, and also improved operations. And part of the activities within this strategy, without going into too much detail, is to ensure that we have strong value propositions for our partners so that they're also achieving their goals and sharing their data with us. And we'll also continue to maintain an awareness of the data space to identify any novel opportunities. Some of our other collaborative efforts include the development of a data acquisition process. So this process really outlines from the initial engagement with a data partner, when we're talking about each of our individual goals and mutual goals in coming together, all the way through to development of a data sharing agreement, the data transfer, and then some of the new aspects that we've been doing with some of our data partners. So one of them is really to work closely with our data partners when we assess the quality of the data, and then work together to develop documentation. As well, we've initiated work with partners to identify innovative data access models with MCYS, Ministry of Community and Social Services. Most recently, we've been able to identify models that will enable them to access information in a way that would be best for them. And we've commenced development of prioritization framework for new data, and we continue to work very closely with our First Nations, Métis, and Inuit partners to not just protect their data, but also to be able to enable them to answer questions that are of importance and value to them. And we'll continue working with non-health and non-traditional data partners. And this is so that we can support our research agenda to increase the understanding of how social determinants of health influence collective and personal health. The rest of the presentation, I really want to focus on the new and emerging partners that we've been working with. And I framed it within the determinants of health. So some of you may be familiar with the Lalonde report that was written in the mid-70s that outlines the key determinants for health in Canada that incorporates inequities. Since then, another report came out. This is Toward a Healthy Future, second report on the health of Canadians. And this was developed for the Federal, Provincial, Territorial Advisory Committee on Population Health. As you'll see, there are 12 factors outlined here, and it's very clear, even just looking at them, how they apply to mental health, addictions, and support services. So I'll be specifically speaking about I wonder if you can see, the areas that are on the puzzle pieces in blue, and those are data partners that we're currently actively engaged with to address any gaps in data. So the first determinant is income and social status. So major review by the World Health Organization found that high levels of unemployment and economic instability in a society cause significant mental health problems. So we've worked very closely, as it was mentioned earlier, with MCYS to develop a data sharing agreement that's much broader than our previous ones, includes several years of data, and is an agreement that would be ongoing. So this agreement is in its final stages of revision, so we're very excited about that. And this includes information about social assistance as well as the Ontario Disability Support Program beneficiaries. And what's really interesting is it not just includes information about the person that's receiving social assistance, but also includes information about the benefit unit, so the family and children. And this data will enable the examination of the association between social factors and various mental and physical health outcomes. For example, this data can facilitate studies in the under 65 population by providing eligibility data for those on the Ontario Drug Benefit Program. The next determinant is education and literacy, and it's clear how these are important not just for mental health, but other chronic conditions as well. So we've been working very closely with the Offord Center, who are the ones who have developed the Early Developmental Index. This is a kindergarten readiness tool that's conducted, and it has coverage over all 72 public school boards in Ontario. It has 5 different domains that includes physical health and well-being, social knowledge and competence, emotional health, language and cognitive development, as well as general knowledge and communication skills. And this will enable us to examine things like the impact of childhood emotional health on later life mental health outcomes. And we've started very recently conversations with the Education Quality and Accountability Office, or the EQAO. They're an agency of the Government of Ontario, and they conduct the standardized tests in different grades within all publicly funded Ontario schools. So people might be most familiar with like grade 3, grade 6 tests that evaluate math and English in different ways as well. So we're in very early discussions with them, but we really hope that being able to identify a joint project, which is our first step we're engaging with them about, will enable us to have a broader partnership with them, and it would enable us to look at questions like the impact or look at the prescribing patterns of prescriptions in children and the impact on standardized educational scores. Factors related to indoor air quality and the built environment, like walkability, can significantly influence our physical health as well as our psychological well-being. So we've started work with the Canadian Urban Environmental Health Research Consortium, and this is a group that's focused on compiling standardized environmental health data. So this includes information about air quality, walkability, noise, and climate. And so this will really enable us to explore the relationship, for example, between green space or the built environment, mental health outcomes, as well as other chronic conditions. We're in very early stages with this partner, but we're very excited about the partnership. The next determinant is personal health practices and coping skills. We've been working with the Ontario Health Study, and this is a research group out of the OICR, and they have collected health data on over 200,000 participants through many different platforms, including on online questionnaires, physical measures, and blood samples. And we finalized a data sharing agreement, are in the process of transferring the data. When this data is linked to the rest of the ICES data repository, it will provide researchers with a rich source where they can investigate the relationship between genetics, lifestyle, environment, health, and health service utilization. So evidence on the effects of early experiences on brain development, school readiness, and health in later life has sparked a growing consensus about early child development as a powerful determinant of health in its own right. We have an established partnership with the Better Outcomes Registry Network. This is a perinatal registry for Ontario, and it captures not just prenatal screening data, but perinatal data as well. And it captures information at the hospital, regardless of whether it's a midwife or a physician assisting the birth, including information about pregnancy, labor, birth, and early newborn care. And we've already transferred data with them, and this is another example of a partner where we're working closely with them to understand the data and to also expand the data that we are getting from them. Next one is culture. So again, we're very happy to have our partner from the Federal Immigration Ministry, Immigration, Refugees, Citizenship Canada here with us. This is the federal immigration information about refugees and permanent residents. So as you saw from Astrid and Paul's presentations, you can see how mental health does impact immigrants and refugees uniquely. And this really speaks to the value of this data and why it's important to integrate this type of non-health data with the health data that we have at ICES. And the last section is the health services data. So I'm going to speak about some of the more, I think, the newer partners that we've worked with and as well as some of the data partners that are focused on mental health. So the Narcotics Safety Act, part of that entailed developing a monitoring system for narcotics, so for monitored substances, and this was fully implemented in July of 2012. So this is a narcotics monitoring system which captures information about all prescriptions that are filled at the pharmacy for controlled substances, so including opioids and benzodiazepines as well as many others. And the power of this data is really that it captures the information regardless of payer. So whether you're paying at cash, it's a private insurer that's covering it, whether it's Ontario Drug Benefit, all that information, it would be captured here. So in the past, we've only been able to have limited information based on the payer. And this will enable us to monitor the opioid crisis, as well as potentially look at risk reduction in pregnant women. And we were also very excited to hear about OHIP Plus, the Child and Youth Pharmacare program that's being developed and is planned to be rolled out in January of 2018. And this will enable us to have a population-based information about children and youth receiving prescriptions because it covers all prescriptions. And we can look at questions such as the prescribing patterns and overprescribing of psychotropic medications in children. And this last slide is about the community-based mental health services. So on the right-hand side, it's the data for mental health services for children that are accessed at the community, so children and their families. So some of the data that was discussed earlier today was the KINARC data, and what we're really excited about is working with the Ministry of Community and Youth Services, Ministry of Children and Youth Services to plan how we would engage with other lead agencies to be able to work with that additional data to fill in the gap outside of the KINARC circle. And in terms of adults, we have data that are kind of bucketed into three areas: mental health, addictions, and support services. So the OCAN data, or the Ontario Common Assessment of Need tool, and this is data that covers mental health alone, and this is with data from mental health agencies. And what we're working on right now is developing a working group that includes stakeholders and experts to understand the quality of this data and how it would fit with our health services data. And doing some deeper dives looking at things like wait times for these services. And we also have the community business intelligence, which is CBI, which captures information from all three regions, but a smaller amount. And so this is information from the Toronto Central LHIN, and it captures this information that's also working with the Reconnect Mental Health Services. And so we're currently working on understanding this data and also releasing a data later this year in collaboration with Reconnect Mental Health Services and ICES. So you've heard a lot about what we've done with this data that we have, and this is really as we venture very carefully and into the non-health data space. So what we really hope is over the next 10 years, we'd like to have mental health data that provides, that is reflective of services that are provided in various settings. So prior to having this OCAN, CBI, and KINARC data, we didn't have any data about mental health services provided in the community. And mental health conditions, unlike most other health conditions, people with those conditions do receive services in many different venues, in the community, in the healthcare system, in schools. So we really hope to have a better, more comprehensive picture of these services that are being provided. And what we're hoping is also to work together with partners such as yourself who have many different data sources, but together we can hopefully create a synergy, bringing this data together, and this is something we couldn't do alone. And this would be very important for not just mental health conditions, but for other health conditions as well. Thank you very much.
Okay, so very exciting, I think, roundup of the directions where we're moving, some which we're very close to achieving, and some which are a bit more aspirational, but I think all of which sets us on a course to having a better understanding of mental health and addiction services in Ontario. So I want to thank all the speakers, the panelists. You did a remarkable job of staying on time today. And so I'm going to close now. I do want to just remind you there are evaluation forms in your packages. Please do fill them out. We really welcome that information to help us make sure that we can improve these kinds of sessions. I also want to remind you that the full report, the Child and Youth Mental Health in Ontario 2017 scorecard, is available on the ICES website, so please feel free to take a look. I want to thank our team, Paul and Astrid and the entire team of scientists and staff that produced the report, and the staff that organized this day. I think it's been a really terrific morning of evidence and exchange. We saw data and analyses, and we heard about policy initiatives. But as we all know, whereas we reported today averages and rates for the Ontario population, each and every data point that contributed toward those analyses represent a story. They represent a person, and they represent their journey. All of us have stories of these kinds of journeys. Sometimes they're the journeys of our family members who struggle with mental health and addictions. Sometimes it's our family, it's our friends or our colleagues, and sometimes it's ourselves. These stories in aggregate become the data that we presented here today. Anna Greenberg on the panel said that in Ontario we were lucky to have this kind of data and sophisticated analytics, and she's right, we are lucky to have that. But I think what we're even luckier to have are the kinds of partnerships and joint commitments that this symposium and your presence here, physically or virtually, represents and asserts. And it's our collective action and commitments that really will pave the way forward towards lasting solutions. So thank you all for participating today, and we look forward to continuing this collective work going forward.